Hello everybody and welcome to the Tuesday edition of Video Clips. First of all, just a couple of announcements. Tonight, February 26th, Brigitte Blanco is our guest speaker on our member call. She is a wellness forum facilitator in Philadelphia and also an expert on nutrition in pregnancy and childbirth, and that's what she's going to talk about. So those of you who are interested in knowing more about how to have healthy pregnancies and easier childbirths, Brigitte is the expert. And then on February 28th, later this week, is our next Introduction to Plant-Based Nutrition Wellness 101 class. 90 minutes, power-packed, lots of information, get you on a jumpstart program to adopt a plant-based diet and know what you're supposed to do and how to go about doing it. Now, got a bunch of emails last week and comments from some of you because we're talking a lot these days about isolated nutrient supplements. The question about B12, and I'll give you the short answer. The longer answers you can find in our curriculum book if you're a Wellness Forum member. Also, lots of articles in the Health Grace Online Library about this, but I don't have any objection to people taking B12. You're certainly not going to hurt yourself with it. It is harder to develop a B12 deficiency than many people imagine, and actually we see this more frequently in meat eaters than in plant eaters, mainly because meat eaters are famous for having gastrointestinal difficulties that tend to interfere with the absorption and utilization of B12. But really can't find any evidence that a supplement hurts you. Now, for those of you inquiring about vitamin D, this is a supplement I generally advise against because not much documented benefit, lots of potential risk. Again, information about all of this in our curriculum book, lots of articles in the Health Grace Online Library, and also a pretty good chapter on supplements in my book, Solving America's Healthcare Crisis. And so while we're on the topic of isolated nutrient supplements, today I have two articles to review. And the first one is about omega-6 fatty acids and their influence on heart disease deaths. And according to an article in the British Medical Journal, people who reduce their intake of saturated fat and increase their intake of polyunsaturated fat end up having higher risk of coronary artery disease and dying from coronary artery disease and other things too. And the reason this is important, it's just an example of how misguided our efforts to focus in on a single nutrient manipulation really are. So where do you find these omega-6 fatty acids? Well, you find them in animal foods, but you also find them in vegetable oils like corn, safflower, sunflower, soybean, and in margarines made from these oils. One example being Earth Balance, which is a popular butter substitute in the plant-based world. And by the way, I don't have a problem with people occasionally using Earth Balance, but most people are using too much of it because, let's face it, creamy, buttery substances really taste good. But they're very high in fat, they're 100% fat, very caloric, so you can't eat that stuff every day. Nonetheless, Americans have been advised to reduce saturated fat, increase polyunsaturated fats, including from oils and margarines. And even the American Heart Association recently issued guidelines instructing Americans to do just this. It's almost hard, well, I was starting to say it's almost hard to believe, but then the rest of the dietary advice that comes from the American Heart Association is generally so miserable. I guess this shouldn't surprise us. But anyway, this data came from a long-term study that included 458 men who had had a recent coronary event. And at the beginning of the study, they were eating more saturated fat, less of the polyunsaturated fat. They reduced their saturated fat, increased polyunsaturated fat. I won't go through all the statistics here because it really is boring for me to recite this to you. You can read the article when we post them on Health Brace later today. But the bottom line is that during the follow-up, an interesting thing happened. Cholesterol dropped in the group that were eating the increased polyunsaturated fat, so biomarkers improved, but all-cause mortality increased in the intervention group, and cardiovascular death rate increased. And so it's just a good example of how you can change biomarkers in the short term and not affect things very positively in the long term, which is why we keep telling people you have to pay attention to dietary patterns. So an editorial accompanied this study in the British Medical Journal, criticizing the American Heart Association and saying maybe they're much kinder than I am. Maybe they ought to reconsider their advice. I think maybe they ought to go out of business. I'm a little bit more direct than they are. But anyway, the take-home point here, 2 or 3 things I want you to remember about this. First of all, we got to stop paying attention to these single nutrients and thinking that by manipulating one dietary marker, we're going to change somebody's health outcomes, whether it's in the form of manipulating it via a couple of food choices or taking these things in isolated nutrient supplement form. So lower the fat in your diet to 15% or less. That's where the action is. There's no benefit of consuming lots of oils over saturated fat. I mean, you can't really get your fat down to 15% if you're going to do that stuff anyway. And pay attention to the whole dietary pattern. Now, the next article that I want to talk about, you're not going to be surprised, those of you who've been listening to me for a long time, this is something I talk about often. According to a recent study, most young children who are treated for attention deficit hyperactivity disorder are not getting better as a result of the treatment. I'm not surprised. I've seen that firsthand myself with members and their children here at the Wellness Forum. But I'll give you the exact statistics. This is one case where I think it really counts here to be specific. The study included 186 kids between the ages of 3 and 5 who were diagnosed with ADHD. They were treated for their condition in the usual ways. After assessment, they were generally given drugs and referred to pediatricians for ongoing care. And the researchers tracked inattention, hyperactivity, and impulsivity by getting reports from parents and teachers and also during their visit with the clinicians. 90% of the kids continued to exhibit symptoms of ADHD 6 years after the diagnosis, and 2/3 of these kids were medicated. Those kids displayed symptoms just as severe. In fact, there were more kids in the medication group that had serious inattention issues than the kids that were not medicated. So actually worse off from the medication than better off. It's not surprising. There are many, many studies who have shown this same result. And in fact, Dr. Peter Breggin, who gave, I thought, a riveting couple of talks at our conference last year, he talks about the inadvisability of prescribing these drugs for kids or adults for ADHD or depression, anxiety, name a condition. This was a direct quote. He said, "I don't believe in ADHD." And actually, I don't either. Children and adults can be taught to focus, and they can be taught that focus is a choice, that you can choose to do this. Particularly with kids, clear consequences of poor decision making will encourage kids to make better decisions when at school and other times when it's appropriate. This is a behavioral issue, this ADHD thing, that should be dealt with good parenting and proper classroom approaches, not medicating kids and temporarily showing some improvement in symptoms maybe with long-term disaster. I think this study, though, shows that there isn't much improvement in symptoms. Well, in spite of all of this, 7% of America's kids right now in the United States are currently medicated for ADHD. And these drugs, not only are they ineffective, as I've just spoken about, but they have adverse physical effects. They impair a kid's ability to learn, develop healthy relationships, and emotionally mature. But some of these kids are also, in addition to taking these drugs, taking a lot of time to visit with doctors and pediatricians and psychologists and psychiatrists. And our tab for this whole insanity here in this country is close to $50 billion a year. I mean, we just can't afford this nonsense anymore. And we really need to address this, as with all other issues, at the core. The core is teaching kids and adults who have this issue to make better decisions and to choose to focus, and then learning focusing skills. It is a teachable skill. My parents taught it to me, and I've taught it to many others, and I've watched kids and adults get better by getting the right type of therapy. So that'll be it for today. We're running out of time, but have a great day, and I'll be back to you on Thursday. As usual, feel free to pass this on to anybody who you think might enjoy watching it.